Good morning. This is a presentation of a study done by Montse, Romero, and Mireia, Canals, Botines, and its title is How to Integrate Gender in Health Research, a case study. Balancing work, social obligations, and caring for a family has become a major concern for a growing number of people. And in terms of healthcare, most social protection systems confirm to be marked by ideological connotations rooted in the family models based on the old social concept of the sexual division of labor. To explain the process to apply for a gender-sensitive health research project, this is the first of the main goals of this research. Also, to answer why do we talk about gender in research and what is gender-sensitive research and how to guarantee gender balance in a health research study. Also, to discuss the process to integrate gender equality in health projects, considering the existing gender bias in healthcare and the gender dimension in their content. And with it, to analyze a case study, the Resicovid 19 research project, which was held between April 2021 and September 2022, which was granted by the Área agency from the Catalan government. This project assessed the impact of the COVID-19 pandemic on people who lived in residences, dependency and mental health homes in Catalonia, as well as the families, workers, and on the organizations themselves. It will show the results found in terms of language, research team, and the research tools used, as well as the subject of study. Gender perspective must be considered in all phases of a project, and in this respect, they et al. State the understanding gender-related variables that can help to produce the best health research evidence. Moreover, gender-sensitive research should eliminate androcentric biases in its design, content, and results. Research has shown gender differences in health and its outcomes. Furthermore, gender inequalities in healthcare are propagated in detriment of millions of people, mainly women. According to Solans, Domènech, and Savorit, there is a gender bias in healthcare, which is mainly based on 3 points: incorrectly assuming that health problems of women and men are the same, on the basis that there are biological and psychological differences where there are only some limitations and similarities, and on underestimate biological differences on top of cultural and social reasons without further interference based on biological differences, and this is appointed by Dr. Valls-Llobet. Historically, health professions have been marked by gender, and gender beliefs have been incorporated into professional work. And then for a long time, there has been a gender division of professional workmen that have higher status and better paid professions in medicine and dentistry, while women's health work has been more focused on support occupations like nursing. However, feminization of professions is calling into question the traditional division of labor based on gender. Women's participation in expanding in traditionally male-dominated professions. And then in recent years, the European Commission has committed to promoting gender equality in research and innovation. And one of the 6 priorities of the European research area is gender equality and the integration of the perspective of gender in research. And these are the 3 main objectives: to promote gender equality in teams and in all levels of research careers, to guarantee gender balance in decision-making positions, and also to integrate gender into the content of scientific research. As for the methodology, Resicovid 19 is a project funded by the Agència de Gestió d'Ajuts Universitaris and Recerca under the program of a pandemic in 2020. Was led by several research groups in the University of Vic, Central University of Catalonia, in collaboration with other institutions and organizations, NGOs, and national representatives and international representatives as well. Its overall aim was to understand the multidimensional impact of COVID-19 on the residencies, paying attention to people, the values, ethical and gender aspects, as with a systematic vision of the sector. Also, the study was focused on Catalonia, Spain, where 60,000 people currently live in approximately 1,000 residences. Resicovid-19 wanted to answer the questions prior to preparation, implementation, and presentation of the results of the project to promote gender equality in teams and at all levels of research careers. Following these objectives, the following aimed to answer the questions prior to the preparation, implementation, presentation, and dissemination. And in reference to the integration of gender in the content of scientific research, the report looked at the following content of the three phases: a qualitative report stratifying by gender, specifying the number of female and male residents, carers, professionals, bearing in mind that 548 women interviewed and 231 men in total have been quantified. A language phase with a linguistic review, sexism and androcentrism review. The interview questions of the four sectors interviewed were reviewed. And as a third phase, the interviews where the inclusive language, or not, was analyzed, and it's emptying to collect the gender perspective. Also, the results found in terms of language research team and the research tools used, as well as the subjects of study, offer diversity aspects to consider when it comes to a gender-sensitive approach in health research. Results showed women are most professionals, family caregivers, and management bodies considered in this research. Inclusive language in the proposal and corrections had to be contemplated in both service and in the interviews, as it states that men, women, and people of diverse gender identities can have different vulnerabilities, symptoms, and responses to health interventions. Results highlight the feminization of residents and people who take care of the family sector. They indicate that most of the family caregivers are female, 79%. The results also aligned with prior studies in Spain, which stated that women represent 80% of the family caregivers. The article, as for conclusions, aimed to explain the process to apply for a gender-sensitive health research project. It intended to answer why do we talk about gender in research and what is gender-sensitive research and how do we guarantee gender balance in a health research study. It discussed the process to integrate gender equality in health projects, considering the existing gender bias in healthcare and the gender dimension in their content. The purpose of this article was also to provide guidance on how to apply it for a health research project that is sensitive to gender issues. It aimed to address questions such as why gender is relevant in research, what characterizes gender-sensitive research, and how to ensure gender balance in a health research study. It also discussed ways to incorporate gender-sensitive gender equality in health projects, considering the existing gender bias in healthcare and the gender dimension in the project's content. Health research, however, remains open to new and more accurate tools to enhance gender-sensitive approaches, which evolve to a fairer society that represents us all. Thank you. Thank you very much. This is it. These are the references that we have been mentioning throughout these presentations, but you will find extra references and more detailed notes on the state of the art and methodology and tools used in our published article in the days or months to come. Thank you very much. On behalf of Montse, Romero, Mas, and Mireia, Canals, myself, from the University of Vic, Central University of Catalonia.